Steeped in history, Sydney Hospital shares its beginning with Australia's founding at Sydney Cove. While these beginnings were humble, they were also honourable. Underneath a canopy of harbourside tents, convicts and a growing number of free settlers were treated for a range of medical conditions. This modest tent hospital soon grew to capacity, spilling into nearby stone outbuildings around Sydney Cove. A turning point was reached in 1810 when Governor Lachlan Macquarie commissioned the construction of a more permanent hospital building. Rum traders Alexander Riley and Garnham Blaxall, along with the acting principal surgeon Dr. Darcy Wentworth, provided the only tender to build the much-needed structure, which was to relocate further up the hill from Sydney Cove. With a scarcity of funds in the public treasury to finance construction, the trio agreed to commence works, on condition they were granted exclusive rights to import and sell 45,000 gallons of rum. The deal was made, and construction of the Rum Hospital, as it became known amongst the colonists, began. The first step in this historical journey was to build a road to transport building supplies from the harbourfront to the construction site. This road is Sydney's historic Macquarie Street. On October 30, 1811, less than 25 years after first settlement, Governor Macquarie laid the foundation stone for the General Hospital, or as it was known, the Rum Hospital. The Rum Hospital was demolished in 1879 and replaced with the existing Macquarie Street buildings. In 1881, the hospital officially became Sydney Hospital. The Rum Hospital opened its doors to the public in 1816 and soon became home to many medical breakthroughs. The medicinal benefits of native flora were explored by one of the hospital's first assistant surgeons, Dr. Dennis Considine, signifying the start of Australia's journey into medical research. The first post-mortem in Australia was conducted in 1827, and the first general anaesthetic in Australia was administered in 1852. Countless Australian firsts in medicine, surgery and nursing continued to unfold within the walls of Sydney Hospital. Australia's first X-ray was taken, the first radiotherapy treatment took place, the first blood transfusion was administered, the first frozen section pathology testing was carried out, and the first melanoma unit was established. Many of these remarkable achievements were conducted before the turn of the 20th century. Significant developments also unfolded in the field of ophthalmology. Australia's first specialist department opened in 1878, an ophthalmology ward which was soon referred to by all as the eye beds. The eye beds proved very successful, and in 1882 they were moved to Moorcliffe at Millers Point. In 1922, the ophthalmic department, as it was then known, moved to Woolloomooloo, where it became Sydney Eye Hospital. In 1996, Sydney Eye Hospital returned to the Macquarie Street site and within the space of 1 century would become the largest eye hospital in the Southern Hemisphere. Within this period, the foundation of nursing in Australia was also established. Answering an appeal from Henry Parkes, the first Colonial Secretary of New South Wales, Florence Nightingale sent one of her finest nurses to Sydney in 1868, a visionary woman by the name of Lucy Osborne. Lucy Osborne laid the foundation for nursing in Australia, and the Sydney Hospital Nursing School was created. The Nightingale Wing at Sydney Hospital remains the oldest building on the Sydney Hospital campus today. Following the Second World War, Sydney Hospital continued to set the pace for medical innovation. Australia's first coronary care, leukaemia, colorectal and melanoma units were introduced to treat acute, often life-threatening diseases. The first medical institute in New South Wales, the Kanematsu Memorial Institute of Pathology, opened within the walls of Sydney Hospital on the 20th of April 1933. The institute provided diagnostic pathology for the hospital and was later equipped as an innovative research centre. This forward-thinking institute also produced 2 Nobel Prize winners. The first New South Wales Nobel Prize in Medicine was won by Sir John Eccles in 1963 and his collaborator, Dr. Bernard Katz, in 1970. Medical history continued to be made in 1969 when Sydney Hospital pioneered the first hand surgery unit in Australia under the guidance of Associate Professor W. Bruce Connolly. What is now the largest sexual health service in New South Wales, the Sydney Sexual Health Centre, started out as the Blue Light Clinic in 1933, servicing local sailors, and eventually moving to Sydney Hospital in 1986. The Sydney Sexual Health Centre, as it's now known, treats over 20,000 patients each year. Historic advances also took place in the area of primary health care, with the establishment of the King's Cross-based Kirkton Road Centre in 1987. This off-site public health service provides treatment and outreach services for HIV and other sexually transmissible infections among sex workers, people who inject drugs, and at-risk young people. Sydney Hospital's clinical innovation was far-reaching, changing the lives of patients beyond New South Wales and indeed beyond Australia. In 2007, Sydney Eye Hospital ophthalmologists Dr. Gina Court and Dr. Con Petzoglou conducted world-first combined ophthalmic surgery on a paediatric patient from Papua New Guinea, Julian Inakombu, a testimony to Sydney Hospital's increasingly international outlook and pioneering spirit. Sydney Hospital and Sydney Eye Hospital today function as one hospital co-located on the original Macquarie Street site. The new Clinical Services building at Sydney Hospital was completed during 1995 and now boasts modern facilities. The hospital now comprises of inpatient beds, emergency and eye hospital outpatient departments, 2 levels of clinical wards, and a state-of-the-art operating theatre complex, providing world-class healthcare to Sydney's 500,000 CBD workers, as well as visitors to the harbour city. The hospital's specialist service also extend into the heart of King's Cross at the Kirkton Road Centre. With its city-based location, the hospital is a key triage centre for major events and disasters, maintaining a critical role in event planning, disaster management and recovery strategy for the city. Since Lucy Osborne founded professional nursing in Australia almost a century and a half ago, highly trained nurses now work throughout Sydney Hospital in areas as ophthalmology, hand surgery, general medicine, sexual health and drug and alcohol treatment. The Sydney Eye Hospital also harnesses tertiary education, performing a vital role as a teaching hospital and tertiary referral unit, which provides surgical and medical management of vitreoretinal, corneal, glaucoma, oculoplastic and oculo-oncology conditions. Sydney Hospital's dedicated hand unit is today a specialised tertiary referral centre for hand trauma, abnormalities and diseases. The hospital's specialist services also have a strong connection to, as well as on-site resources, with the University of Sydney. Sydney Hospital continues to offer world-class medical, nursing and research opportunities, providing teaching and specialist training and attracting some of the most qualified and specialised health and health research professionals. The commitment of improving the care and quality of life of its patients will remain at the core of the hospital, treating patients with innovative and specialist healthcare to improve vision, hand dexterity and movement, the detection, treatment and prevention of sexual health conditions, and the treatment of addictions. From its first fleet beginnings to a long line of medical firsts, Sydney Hospital has been the heartbeat of quality public health care in Australia's most historic and iconic city. Sydney Hospital will continue to drive and serve as a proud benchmark for innovative specialised healthcare in New South Wales into the 21st century and beyond. The words of Sydney Hospital's 200-year motto still ring true today and long into the future. Ut primus, sic optimus. As the first, so the best.